So moving on to my next video, we are now going to be doing trach suctioning. Here's my patient with her trach collar. I've got my normal saline here. My suctioning is connected to the wall on low intermittent suction, and that's working. I have my box here still set up for my last video, but I'm still gonna include that in this video, but it's already there. So I would go ahead and introduce myself to my patient, let my patient know that I'm here to suction them. Her O2 sats are really low. She's been sitting around in the low 80, in about 85. So I know that she may need to be suctioned. I've done a lung assessment. Her lung sounds, I hear a lot of rhonchi in there, wheezing. She's having difficulty breathing, and she is showing serious signs of distress right now. So I'm gonna try to relieve her of those symptoms by suctioning out her trach a little bit to get rid of some of those secretions that are causing such a hard time for her. So I would wash my hands, introduce myself to my patient, and explain to her what it is I'm doing. I said I've done my lung assessment, so I'm gonna go ahead and get my stuff set up. So I'm gonna go ahead and open my kit. I would open my box first. I've checked the date of my saline, and it's been open since this morning. So I do need to lip it. I would go off to the side in my trash can, and I would lip it in my trash can, and then I can proceed to pour into my box after I have opened it. That's for my sterile water, my saline. So now I can go ahead and open my gloves. I'm gonna push this out to the side. I'm just being mindful of those 1-inch borders. Opening here. I've got to get a new pair of gloves now because these are ripped and it's hard to open. I'm gonna go ahead and open and put on my right hand. Then we're going to put on the left hand as such. That's me putting on my sterile gloves. Now I know throughout this procedure, my left hand is going to be unsterile because that is my non-dominant hand. My right hand is going to stay sterile. So I'm going to go ahead and grab my catheter. My catheter is going to stay in, this end of my catheter is going to stay in my right hand, again, because this is my dominant hand and we're staying sterile. And I'm going to use this hand to connect my catheter to suction. Okay, so this hand is now unsterile. We're connecting to our suction. I'm gonna go ahead and test out my suctioning with the water. Suctions perfectly. So now that we've got that done, again, this hand is not sterile, I'm ready to go ahead and suction my patient. Before I suction her, I'm gonna go ahead and remove her trach collar. The trach collar that just came off, I would remove her trach collar with my left hand, being that it's my non-sterile hand. And I'm gonna go ahead and oxygenate her with my ambu bag before I start because I want to hyperoxygenate my patient just in case. So I'm going ahead and hyperoxygenating her, giving her about 1 to 2 breaths, 1 breath every 1 to 2 seconds. Not too fast and not too slow. And I would do that for about a minute. Now that I've got that done, I'm ready to go ahead and suction. There's no need for lubricant because we're going into an artificial airway. I would just go until I feel some resistance. Again, I'm not holding this as I'm going in because I would be suctioning going in and we're only suctioning as we're coming out. So I'm gonna go ahead, my patient's sitting up in a semi-phallus position, head of the bed is raised. I'm gonna go ahead and insert. And I feel some resistance and my patient starts to cough. So I'm gonna go ahead and begin suctioning. I'm suctioning by plugging the port and rotating out on my way out. And then I would hold it as such. I'm gonna go ahead and clean my catheter off a little bit because I need to suction, and I'm gonna go ahead and hyperoxygenate her a little bit because her O2 stats are dropping. My patient is on continuous pulse ox, so I'm able to monitor. I would give her oxygen for about a minute, allow her to relax, then we can go ahead and continue suctioning. I'm gonna go back in. My finger would be off of that, sorry. And we're gonna suction coming out. Okay, and now that we're done, I can dispose of my catheter and my gloves. I would go ahead and oxygenate my patient again. I would perform another lung sound assessment, and I see that her lung sounds are much, much clearer now. I again would oxygenate her, return the trach collar, and I would document my findings. I would document the secretions that I got back. And that's it for this video. Stay tuned for my chest tube.